Hi, my name's Hunter, and I've had the All-on-X for 4 years now. So the biggest issues that I dealt with were pain in my mouth, missing teeth, and between the combination of that, I had a really hard time eating. I was in pain all the time, and it was really bad. When I started looking into getting the All-on-X, I went through and just couldn't live the day-to-day life without thinking about my mouth and the situation that I was dealing with. I was dealing with that pain for probably, I want to say, pretty much my entire life since I was probably 16. I am not 100% sure, but my parents always told me that I had a condition when I was a kid that affected my teeth, and so it made my teeth soft, and so they broke really easily, and a mixture of kind of not taking the best care of them myself, and so it got to a point where I just was dealing with it basically since I was a teenager, and it just continually got worse over time. Confidence, I had none. I had a junior high school teacher that he went around the gymnasium. We were all sitting together as a class, and he was looking at people's teeth, and he got to mine and he said, "Ugh, that's a smile, you should probably take care of that." And so that was a huge impact in my life, because it essentially just destroyed my confidence, because I looked at all the other people that had great teeth and I just was never that way. And looking from teachers are supposed to be leaders, they're supposed to help kind of guide kids and the generation, and to have something like that happen from a teacher was really detrimental. And then on top of that, I just wasn't proud of my smile, and so I didn't have the confidence. I never smiled. I just found a way to hide my teeth all the time because I didn't want anyone to see them. So going through the process of researching, figuring out where I wanted to get something done, I didn't have a dental office that I typically went to, and so I was in the market for not only a dental office, but someone who could look at taking all of my teeth out, because I had made the decision that I was ready to get my teeth taken out. I didn't want any of them anymore, and I was open to options, but ultimately those options were replacing everything more so than fixing what was in there. I did a lot of online research. I did a lot of YouTube videos, watching all sorts of stuff, reading articles, reviews for dental offices. I went to Stubbs, had a consultation with Stubbs, and wasn't approved for anything to start. And so I kind of left feeling a little bit defeated, but kept at it. Went to a couple more consults with some oral surgeons, and was looking for the full mouth replacement options through the different clinics. And ultimately, I landed back at Stubbs. For me at the time, budget was an issue, and so Stubbs had the best price, but ultimately it was the people and the doctors that pulled me in. Some of the big things that really made an impact for me were they did a tour to kind of show me around the office. No office had ever done that for me before, so that was actually really cool. And then the doctor sat down with me and just went over my case and said that I would be an awesome candidate for this because it would be a fresh start for me. And he looked at me and agreed with what I had been saying for a really long time, because a lot of dentists had told me, save what you can, don't go through this process quite yet, you're still really young. He was the first doctor to look at me and say, I agree with you, I think this is a huge step in the right direction for you, and let's do it together. And so building that trust of, I had been told by so many people, don't do it, and having someone look at me and say, no, this is actually going to be huge and beneficial for you, really sparked my want to get it done and get it done with Stubbs. The experience overall was phenomenal. I never had a single issue that came up between the staff, between the doctors, everyone that worked with me. They welcomed me by name every single time that I came in, and it just got to a point where they knew me and they knew who I was, and it was a journey for sure, because a lot of that journey was healing time and honestly just time waiting to be able to finish the process. But even during the waiting times, everyone checked in on me, made sure I was doing okay, and it was just really special.
Oh my God.
Yay! They look freaking good.
Oh my God. I get my bleach back.
Mm-hmm.
Oh my God.
Yay!
Awesome. God, they look so good.
So I had my surgery in January of 2021. After that surgery, I was going to the post-op appointments at the Lehigh location, and I just talked to the lead assistant that was there at the time, and I told her I was feeling a lot better, and this whole process had just changed my life, and I had teeth and I had a smile and I didn't have pain. Even when I had the discomfort from surgery, it was still less pain than dealing with my teeth in. And so I started talking with the lead assistant and told her I was interested in becoming a dental assistant after this whole process, and I didn't really know where to start, so she gave me some pointers. And so I took a 3-month dental assisting course. I had to get internship hours for that course, and I had to do about 50 of them. I didn't have a home clinic, a dentist that I had seen for years and years, but I had Stubbs, where I just had this major surgery. And so I started to intern. And I just was in the back in the clinic helping break down rooms and just learning, soaking up as much as I could, learning the processes that they do. And eventually the dentist sat me down and said, well, here's the thing, kid, you're not gonna learn anything doing our dishes. So the next appointment that I have, I want you to assist with me. And he was really patient with me, and he just kind of helped walk me through with the help of the assistants that were there. They walked me through the processes, and they said, here's how we do this, here's how we do this. And they got me actually assisting. And before I finished my internship hours, the lead assistant asked me to submit my resume to Stubbs, and they had been looking for an assistant, and they were doing some interviews at the time. Once I had finished all of my coursework, I was hired full-time at Stubbs essentially the next week, and I started my full-time work at Stubbs, and I've been there ever since. Getting to watch all of these transformations is my favorite part of coming to work, because I got into this business, this industry, into Stubbs for this reason, because I had my entire life turned upside down, but in the best way, and it changed my work life, my home life, and now I get to see that exact same thing happen, and I see it every single day. I am able to relate with patients on just a much different level than even sometimes the doctors, just because I've been through the process and I can answer questions. And there was a case that happened the other day that he's going through kind of essentially the same thing that I went through, and it was just really cool to see that I was able to give him some advice and say, hey, this is perfectly normal, this is actually exactly what I went through. And I can do that on just, like I said, a different level than a lot of people can, and just relate and have empathy for the patients and what they're going through. Overall, since I've had my All-Nex, life has just changed astronomically, because now I'm in a hard, durable set of teeth, one that's not temporary, and so I can eat apples, corn on the cob. This last summer, I had corn on the cob, I think for the first time since I was a teenager. And I was able to just without even thinking about it, I just started biting into it and biting through it, and I didn't have to worry about it. I didn't have to worry about a tooth breaking off or falling out while I was eating something. I could just eat, and it was so great to be able to just eat. And I still find myself, I'm 4 years into having this All on X, and I still find myself looking in the mirror all the time and smiling and looking at my teeth, because 4 years later I'm still just dumbfounded with the fact that I have a beautiful smile, and one that I can just eat. I don't have to chew on one side versus the other, and I can go out, I can smile. I have the confidence that I really have never had before. The best words of encouragement that I have are: take the first step, go in and see the dentist, and talk about options. I was at a place where I thought I knew exactly what I wanted, and I just wasn't able to get there. But ask about options. I was a pizza delivery driver when I first came in for my very first consultation, and I eventually worked my way up into management in that pizza chain, and that's when I was able to get approved for getting this surgery done. It takes a little bit of work. Sometimes it can take time. But keep at it. And I think the biggest piece of advice is you are not alone. Everyone deals with these issues at some point in their life. I was so ashamed of my smile for the longest time, and I was so ashamed when I went into these consultations. I can assure you, find a great doctor and they will take care of you. Come in. The hardest step to make is making the appointment and actually getting through the door, especially when you're super nervous. That is the hardest thing to do, is get through the door. But if you can do that, the rest should be pretty easy.